name's Aileen Bryson. I am part of the patient support team at Antibiotic Research UK. We're a small charity, and I just wanted to point out, because having spoken to some other charities recently, there's a bit of a misconception that Antibiotic Research UK, which is the only charity to tackle antibiotic resistance, is about not prescribing antibiotics. And thank you, Melissa, for such one of the most harrowing and saddest presentations and talk I have heard. And there was a bit there where you mentioned, had the antibiotics been prescribed, then your son would have been treated very differently. So this is about, just remember the flip side of being scared to prescribe antibiotics can have some very tragic consequences. And we have heard in various conversations over the conference about exactly that, when prescribers don't prescribe antibiotics. So it's about the appropriate use always. And we do need to tackle the resistance, because we've heard for over 2 days how huge this silent tsunami or pandemic is. So we do need to do that, and that's what we're about. But I do think we always have to remember the flip side. It's not about not prescribing, it's about very appropriate use of the antibiotics that we've got and finding alternatives to them, and going down that road in as many different diverse ways that we can, so that we actually can stop this, which I don't think people are aware of until it happens to them and something happens which they become the subject of antibiotic resistance. And we see that all the time with the patients that come to us. So I just wanted to make that point, and thank you very much for the presentations this morning.
Thank you. Have we got anybody, any other questions?
Would you just like me to respond to that, Lindsay?
Yeah, that's okay, yeah.
So obviously I now work with the UK Sepsis Trust, and obviously William was I don't like to call him a victim, but he was a victim of the, not wanting to prescribe antibiotics because of antimicrobial resistance. And I am a staunch believer that, antibiotics should only be prescribed when it's clinically evident to do so. The differences with William is that observations were not undertaken to establish that he potentially had a bacterial chest infection. So a sputum sample, a blood sample, a chest x-ray. Even the basic observations weren't taken with William, like heart rate, blood pressure, respiratory rate, things like that. So I wholeheartedly agree with you. And the Sepsis Trust takes the same position that, when it's clinically evident to do so, then they should be prescribed, but absolutely not as a answer to everything, because it isn't the answer to everything. So yeah, we support you and your work, and we're very aware of you, Antibiotic Research UK.
Okay, my name is Souza Abdelati from the Heidelberger Center for Cellular Therapy in Heidelberg in Germany. I'm here to tell some good news that we are so far that we don't need to use antibiotics for antibiotic-resistant microbes, because we proved that cellular therapy is the most efficient way to remove all kinds which we faced to date in the last 10 years using cellular therapy. You can remove actually almost all antibiotic-resistant infections, starting from neonatals up to very old age. Very, very successful, and actually without exception. So we could remove all kinds of infections. Corona, all this stuff, within 12 hours, the patients are not virulent anymore. And no matter it is bacterial or viral infection, we can remove it all through cellular therapy. Very simple, very easy, sure, and without side effects. This is the good news which I want to tell the people, and I hope that we will be very fast with licensing in Germany. You know, the European regulations takes a long time. AIDS, I hope we will be finished soon, and we can apply it worldwide even. Thank you very much.
Hello, my name is Amy. I'm an infection control nurse in Gloucestershire. I just had a question for Matthew Cripps, really, and just in regards to behavioural change. How would you manage sort of people who, in the first place, have no motivation and have you can't find the carrot almost, what's the motivation in the first place, especially in the leadership from the top down. I find this a lot in mental health, I can speak personally from mental health side of things, that really struggled to basically engage even the leaders from the beginning. So I don't know if you had any thoughts on that.
Well, I mean, there is always a motivation somewhere, but sometimes they are very, very difficult to find. I think we're in a very difficult place at the moment because everyone's just so overwhelmed and exhausted. So I'm doing some work with trusts in Essex, and one of their biggest problems is even before the pandemic, they didn't have a huge level of engagement from leaders, not just at the very top, leaders through the teams in improvement work, not dissimilar to other places. Now they've got virtually zero. People just aren't motivated to even get into those initial discussions. But there is always a carrot. Sometimes it's not an obvious one. I mean, you know, we always say, well, it's the best thing for patients, isn't it? As if that's going to win everyone over. Well, if that was going to win everyone over, it would have been doing it for 70, 80 years of the NHS, and that alone isn't enough. That may be something that draws us into work in healthcare and helps. And so one thing we do is we're not shy of looking at the self-centered motivations. So GP workload gets talked about a huge amount, but I don't think it gets used as much as it could do as a conscious motivation to get people to do something. So we look at what are the altruistic motivations, which I guess is probably where most people focus all of their attention. But then what are the self-interest ones? Will I get home to see my kids more often before they've gone to bed? Is this going to be flexible? Does it float my boat? Will it make me more money? Will it give me better job satisfaction, etc.? Doesn't, you know, one thing we often say in behaviour change, there's no point judging people. It's just humans being humans. So we either acknowledge it and use it, or we carry on struggling to motivate people. So that would be my advice. Look for the selfish motivations as well as the altruistic ones and combine the two. But one final bit, make the altruistic ones louder and bigger than this, because none of us want to think that we're self-interested, but all of us are. So hide them under the other ones.
Rainey, I'm from Infection Control for Birmingham Community Healthcare. I just want to say thank you all for your presentations, but thank you to Melissa. I myself, and I'm sure lots of people, or most people in the room, through sepsis training that we've received, was able to identify the missed opportunities in your story. So I'm glad that, you know, through that training, hopefully I will be able to be more aware. And also we do include that now in our Infection Control Champions training. So hopefully we are spreading that word as best we can. And thank you all.